Hi everyone, my name is Megan and I am a myofunctional therapist and I help people learn how to breathe, speak, chew, swallow like we are meant to. And today I want to talk to you guys about nasal breathing and how important it is for our bodies and for our immune systems to be able to breathe through our nose. There are so many easy ways to help protect ourselves from getting sick, from eating healthy foods, to washing our hands, to getting enough sleep, to brushing and flossing our teeth, drinking lots of water during the day. But did you know that nasal breathing is another effective way to protect our body against viruses and against bacteria? Our nose filters, warms, and adds moisture to the air that we breathe in. And its natural filtration system works with what's called nitric oxide to kill bad bacteria and fight infection to keep you healthier, even during cold or flu season or the season that we're in right now, talking about other airborne viruses that are going around. So we each have a built-in air filter that helps us turn the air that we breathe into the nitric oxide that defends against those airborne viruses. Did you know that when we breathe through our mouth, it takes our body 6 days to help filter out the allergens from our system? However, when we breathe through our nose, it only takes 15 minutes. It's amazing how our bodies can work for us and not against us. Do you find yourself wanting to breathe more through your mouth than through your nose? I'm going to share 5 kind of easy ways to help you learn how to breathe through your nose more and get that filtration system working to its best abilities. So the first thing we have to ask ourselves is, breathing through your mouth a habit, or has it become a necessity for you? First, we have to determine whether you breathe through your mouth out of a habit that you just do all the time, or is your body reacting to something that it's made breathing through your mouth a necessity? I always tell my patients, if you can't breathe through your nose, you kind of have 2 options. Breathe through your mouth or don't breathe at all. And we all know what happens when you don't breathe at all. So it's really important for us to know, are you breathing out of your mouth because your nose is stuffed up and you aren't able to, or are you breathing through your mouth because it's a habit that you don't even think about anymore? If you can breathe through your nose but you don't, we call that a habit. If you can't breathe through your nose, then we need to find out why you can't breathe through your nose. How do we determine if it's a habit or if it's a reaction? The easiest way is to just grab a timer. You can just grab your phone, you can look at your microwave clock, you can look at a clock on the wall if you still have one of those, and set your timer for 2 minutes. And in that 2 minutes, what I want you to do is I want you to see if you can comfortably breathe through your nose with your lips together. For that whole time. Once your 2 minutes is up, you need to ask yourself, was that hard? Did you find it to be kind of uncomfortable to try and breathe through your nose for that long? If it was hard, then there may be something that's blocking your nose or causing it to be challenging to get your air in. Does it feel really hard to try to breathe through your nose? Like the effort's much harder to breathe in through your nose than it is to just breathe through your mouth? Or is it easy? Did you find out now that you can actually just close your lips, take a deep breath in, and it's not hard at all? If that's the case, then it's a habit, and that's something that we can fix really easily. However, if something else is blocking it, if it's hard, if it's always stuffy, there's more steps ahead here that can help us kind of figure out what we can do to help with that. So step number 2, the next thing to ask yourself is, are you allergic to anything? Do you find that there are times of the year when your seasonal allergies are really impacting you? They start to act up. Are you stuffy all year round? It doesn't matter. Spring, fall, winter, any mix, you're always just stuffy chronically. It's important to eliminate any sort of factors that can make our nasal congestion worse. So in the myofunctional therapy world, in our world, the first thing that we look at and kind of the most obvious allergies are what we call the 3 Ds. So dairy, dander, and dust. okay? The easiest thing to do, I mean, easier said than done, of course, but the easiest thing to do is I recommend eliminating any combination, ideally perfect world, all three, for 30 days to see if you become less congested. You can start with one. You could start with, hey, I'm not going to do any dairy, no cheese, nothing for 30 days. If you're like me and you love dairy, you're like, that's not the challenge for me to start with, you may get an air filter that can help with dust and some of the other dander from pets to help really filter out so you are breathing in clean air. One thing you might have to do is not let your pet sleep on your pillow or in your bed, on your couch, anywhere that you lay down, anywhere that you breathe in for about 30 days, which for some of you may be an even bigger challenge than dairy. So there are so many alternative options these days, at least for dairy. They've got some really great air filters out there, and you know, some really good detergents to wash in your pillowcases before you let your pet sleep up there again to test it out and to find out if any of those 3Ds are what's causing your stuffiness. So the other ways you can find out for sure. You can see what your allergies are. You can meet with an allergist to really see if you're allergic to anything or if any of that's causing congestion. Then we move into step 3. Have you been told you have big tonsils? If you have big tonsils, what happens is they take up space in your airway or in the back of your throat, making it harder for you to breathe. Your tonsils are right back in the back of your throat, and they're little, kind of just little tissue that sits right behind your tongue. And ideally, you don't want them to be bigger than like part of a grape on either side, okay? The other part of your tonsils are called adenoids. You can't look in the back of your throat to see your adenoids. Your adenoids actually sit up here behind your nose, and you need a professional to help you look at those. But something like an x-ray or a scope. However, we can find out pretty easily if your tonsils are big to then go look further into your adenoids. So it's important to find out if they are enlarged, either your tonsils or enlarged adenoids, and if that's the reason why you can't breathe through your nose. How do you find out if they're big? The easiest way, kind of the first way, quick, is to just look at your tonsils in the mirror. Big open wide, and being able to really look back. If they're taking up space in your airway, it's important to get them evaluated, okay? To have them looked at, you'd have to go make an appointment with an ENT, so an ear, nose, and throat doctor. And those doctors use a scope, they use x-rays to help you determine if you have large tonsils. They can look at your adenoids, and that can help determine if that is a factor in your inability to breathe through your nose, okay? The fourth step, and honestly one of the most important steps, is where is your tongue? That is something I ask people daily in my myofunctional therapy practice, is where is your tongue inside of your mouth? Did you know that there's a specific place that your tongue should be resting in your mouth? Your tongue can sit low in your mouth and drop back into your airway, and we call that a low tongue posture. So I've got my good friend here, and what should happen is your tongue should actually be up in the roof of the mouth here, sitting up, supporting the upper jaw, staying up out of the airway, versus floating down here in the lower part of the mouth where it can easily fall back and cause concern and cause blockage of your airway. So it makes it a lot harder to close your mouth and breathe through your nose if your tongue's sitting low and it's not in the right spot, okay? If you're checking where your tongue is sitting in your mouth right now and you realize that it's in the bottom of your mouth or pushing against your teeth, you have a habit, what we call a low tongue posture or a tongue thrust. That's what I work with people daily on to get rid of and to learn how to swallow the right way with the tongue on the roof of the mouth, and to also help encourage the nasal breathing that comes with it. So that leads us to our very last step okay? And that's learning how to unblock your nose. All this information is really great. You know, it gives you guys this kind of the first steps to find out more, see what you can do, see how you can actually breathe through your nose, and it's not challenging. However, what happens if you literally can't breathe through your nose? What happens if you're too stuffy? How do we deal with that? How are you able to clear your nose and take those first steps to really start breathing through your nose and fighting off all these viruses and bacteria? So there's a fairly easy exercise that you can do to clear your nose naturally, okay? You can check out lots of videos on clearing your nose in a few easy steps. You can also try other methods to help you clear your nose, like nasal sprays, allergy medications. Neti pots are another big thing for kind of naturally clearing out your nose. But really, the clearer you can keep your nose, the easier your new nasal breathing habits can take place. If you find that you struggle with mouth breathing, or discovered in this video you have a low tongue or a tongue thrust, or if you snore at night when you sleep, if you have allergies or bad asthma, anything mentioned in this video, you could benefit from myofunctional therapy. Breathing through your mouth puts you at high risk of getting sick more easily, so don't hesitate to reach out and learn more. I hope you found this video really helpful, or at least found some tips or tricks that you didn't know about before. If you have more questions, you want to learn more about nasal breathing, you want to learn more about myofunctional therapy, you can always visit my website. I offer free assessments online and to make everything easier for you. So take a look at that below. Keep an eye out for more videos in the future. I've got lots more information coming your way. Again, my name's Megan Vinoy. I'm a myofunctional therapist, and I'm looking forward to getting to know you guys more. Have a great day.